The federal government has confirmed a total of 7,202 cases of diphtheria out of the 11,587 suspected cases across 105 local government areas in 18 states, including the Federal Capital Territory. Now, the government disclosed this in a joint press statement signed by the Federal Ministry of Health and Social Welfare, the National Primary Healthcare Development Agency, the Nigeria Center for Disease Control and Prevention, and other development partners.
The statement noted that most of the confirmed cases were recorded in Kano State, with 6,185 cases. We're joined this morning by Dr. Oladipo Kolawole. He's a virologist, an international fellow, the Indian Council of Medical Research. Good morning. Thanks for your time. Thanks for joining us.
Good morning. Thanks for having me on this.
All right.
This course.
It seems to be just existing, but it's not making headlines. 450, people plus dead already should be enough to raise a national health emergency with regards to diphtheria. But we don't seem to be doing that. Why do you think so?
Well, I think that is dependent on the angle at which the government is looking at it. Although it is a vaccine preventable disease that we need to look into. Naturally, it saddens our heart as an expert in infectious diseases that a disease that is vaccine preventable, we are having the cases since last year, December. So it means we need to do more of monitoring and evaluation in respect to the vaccines that we are giving our children. What even saddens me as an expert is that this vaccine is part of regular immunization schedule for children. That naturally, if you give birth to your children, you take it to the clinic, you need to get this vaccine naturally without any stress. So it means that we need to look at what is actually happening with our routine immunization. Are people are people going by the rules and regulations that we have laid? And how are the mothers taking their children, their words for immunization at the appointed time? So if we cannot look into these, it's going to be very difficult. We just in the case of diphtheria. In few time again, we might be seeing some other cases of vaccine preventable diseases that naturally we ought not to have the experience in the country because vaccine is already existing for it. So once someone is fully vaccinated, getting his 3 doses, is going to be highly protected against the germ. So I think we need to do more of evaluation and monitoring in terms of our vaccine distribution and availability in various communities.
And when you talk about various communities and vaccination, we're hearing that, of course, the most confirmed cases were from Kano State, 6,185 cases and possibly counting at this point. And we know that there unfortunately is a history there when it comes to the issues around vaccination. But when we look at the total figure of cases right now, 7,000 plus out of the 11,500 plus suspected cases, are we looking at a national emergency now, or do you still think that we have the opportunity as it is right now to contain it? Or have we sort of reached a point where at this point we should expect a further spread?
I think it's not a national emergency, something for now, because we still have the capability to contain it. Because even if you look at those who have been confirmed, if they give them, majority of them respond well to intravenous erythromycin, and that is why we can't call it a national emergency. All we need to do is to sensitize people. Once you have signs and symptoms, go to your hospital, nearest clinic around you, let you be tested. If you are found positive, they commence treatment immediately because treatment is available. So that's why we cannot say that is a national emergency for now.
Okay, and is there something particular about Kano State that makes it seemingly centered around there? We don't seem to have a lot of it in southern Nigeria, even in the Middle Belt. So is there something about the north that makes it thrive there?
Yeah, like I said, that we need to look at our immunization schedule, look at the acceptability rate. The acceptability rate of each state to vaccine is quite different. So, and we have more villages, and that is how we got to know that this state needs to have more. We need to put in more energy into vaccination, because the readiness of each state to vaccines quite differs. So we need more sensitization in Kano State to let them know that if you get vaccinated, you get protected, you are on the safer end than not being vaccinated.
So let me ask, because you mentioned, of course, the vaccination schedule for young children. Once you're fully vaccinated, you're better protected. But if we're having people get it at this age and they're responding to treatment and they come out and they're fine, is it possible to still get the vaccination? Can we expect to see a renewed, let's leave the renewed drive, but is it possible after someone has come through diphtheria to go ahead and get a vaccine, or is it not necessary because then the body's own immune system has built its own immunity and of course its cells now recognize this as a virus? What happens after you come through diphtheria? Is it still medically possible or necessary even to get the vaccine still?
I think from my point of study as a biomedical scientist, I will recommend such an individual to get vaccinated. You know, there are some things that people don't understand about vaccine. Once you get vaccinated, there are a certain amount of antibodies that you need to produce that will make you to be protected against future occurrence. So some of the time, if you get your vaccine fully, even after you have been infected, you have enough antibodies, soldiers in the body to fight the disease. And it stays longer than what you are naturally immune. And that's the rule of vaccine, because if you are naturally immune, the amount of antibodies, the soldiers of the body that you have will be limited, and there is a tendency the numbers of years is going to outlive may not be as much. But once you get vaccinated after you have recovered fully, it enhances your immune system to have enough soldiers that can fight the germs whenever it comes into your body system in the nearest future.
All right. So
and that is why you can see that we recommended booster. That you take the first shot, it means you need to take second, you need to take the third, so that your antibodies will be much, so that the neutralizing antibody will be much, so that you can have enough one to fight future occurrences.
All right, so just for the purposes of information for the audience, the early symptoms of diphtheria may mimic a cold with a sore throat, mild fever, and even chills. And then it can cause a very thick coating at the back of the throat, which can make it difficult to breathe or swallow, also causing sores as well. Dr. Kolawole, where does diphtheria come from? So what we're seeing now is that obviously it seems to be quite contagious and it's spreading, but where does it come from? When we had the anthrax breakouts recently as well, there was sort of a situation, an attempt to investigate down to source, so not necessarily the final source, but at least have an idea of why it's springing up. And we've seen this in the past few months. It'll go down a bit and then the numbers for diphtheria will rise again in Nigeria. So where is it coming from?
I think one of the things that drive the occurrence or emergence of infectious disease pathogen, one of it is our human activities. The way we do things, the way we interact with things. And that is why scientists are looking at what we call One Health approach, that you don't look at a disease, a pathogen from just a single approach. You look from animal, you look from environment. And some of the time, all those pathogens are actually there in the environment. But once our human activities interface and interfere the ecological distribution of those pathogens, there is tendency that we have what we are seeing now. And that is where the vaccine needs to come in. You know, like this one, if somebody is infected, not protected, get himself infected from the environment, get back home, people get in contact with it. Before you know, if you look at what we call epidemiological chain transmission, go back home, from home goes to school, go to work, so that the chain keep moving around. And that's why we have a contact tracing for that. And look at some normal personal hygiene. Like I've said on several occasions that when COVID came in, we were talking about washing of our hands, or the way to cough, the way to sneeze. COVID is like, it seems as if COVID has gone, but it has not. And people have derailed from all those normal public health measures. So as much as we are far away from normal public health measures, we cannot but be having cases like this some of the time. So people need to get vaccinated. People need to take care of their health. And when people have a sign of any clinical sign or symptom, they should go to the nearest hospital. And that's why you see that the government have put enough surveillance in place through NCDC and collaborating laboratories, primary healthcare center, so that they can track the movement and of this pathogen, and so that appropriate measures will be in place per time.
All right. Just before we go, can you quickly speak on COVID-19? You know, there's rumors, you know, that it might be back, you know, and I've heard one or two people already talk about some colds and, you know,
lack of
COVID.
Taste.
Yeah, exactly. Looking symptoms. Is there, you know, any news concerning it returning?
I don't believe so. What I believe as a scientist is that biologically, this virus will want to have a way of surviving. Mutation does not mean it will be virulent. Some of the time, mutation can loss of pathogenicity. But what I'm pretty sure is that all of us should get vaccinated, so that even peradventure there is a circulation of SARS-CoV-2, you are highly protected once you have immunization completed, your first dose and your booster dose. So they are RNA virus and they keep mutating, and some of the time we can't stop them from mutating because we have a survival of the fittest, and they do want to survive, so they are devising more methods and actually they can survive. And that's why you can see some previous months ago we have some new variants that we were talking about. So actually we should all know that SARS-CoV-2 COVID-19 has come and it has come to stay, and we need to get our vaccines so that we can be highly protected against emerging variant that might be coming. And what the pharmaceutical industry does is that they keep updating the vaccines so that the shots you take now will make you to be protected against the circulating thing per time in a geographical environment.
Well,
all right.
Doc, thank you so much for stopping by. We will continue to monitor the diphtheria situation in those states, and hope that it, of course, doesn't spread further. We look forward to speaking with you again.
Thank you for having me on this program.